We are getting a lot of messages regarding this, so we want to lay out a little bit what rib mold actually means. Rib mold, reshaping of the lower floating ribs 10 to 12, with the aim of getting a more dramatic waist reshaping result. Credit goes out to Dr. Kudzayev, a Russian surgeon. He was the one who first described this technique. We've done a couple of modifications, but he is to be credited with the first description. Remember, it's partial fracture. We are doing a so-called green stick partial fracture, minimally invasive, just a very, very small incision. It's not rib removal, and then the fractured ribs are put into position with a dynamic corset compression, which the patient has to do for 3 months. This is a CT scan, I hope understandable. You do see here ribs, red arrows marking ribs 10 to 10 and 11, which I think are essential. Rib 12 is not very large in many patients, or sometimes it doesn't need to be fractured, but rib 10 to 11 definitely. I've picked one case to really highlight, I think, the potential. You do see here, this is the case on the left side after a BBL. Wonderful result, beautiful body, fantastic. And the waist at rib level is 71 centimeters. Now, how can we push this further? There's no more fat left for a BBL. So what do? We do rib mold. You see here, and we've really tried to do this in the same position, the same underwear, and you see waist rib level goes down to 61 centimeters. It's 10 centimeters. It's always a percentage of your waist circumference, but with disciplined corset compression, you can reduce your corset, your waist diameter at the level of the lower floating ribs by about 10, maybe 15%. Case dependent, so very nice change. So wrapping things up, RibMold, it's a great supplement to body contouring. It's minimally invasive, but of course it depends on discipline, corset training after surgery. That is essential, but it has really been a game changer for us, and we're very happy to have this included into our surgical toolbox.